So we're going to tell some stories. Will you tell your story?
Oh, absolutely.
All right.
There's always more to the story. I'm one of the just over 2% of physicians in the U.S. who are Black women.
I had never met a Black woman who was a doctor.
Actually, I'm the only Black physician in the hospital at this time.
That statistic hasn't really changed much in the last few decades.
People study disparities, but what about interrogating them? What about changing them? What about disrupting them?
I thought about all the time and money it took to get through college and med school and public health school and residency, and how hard it was to pay off all those loans.
People told me that it wasn't enough to be smart, to be a doctor, that you had to work ridiculously hard. All the lore about being a pre-med.
Being a physician, it's just part of you wherever you are. Your first instinct is to help. It doesn't matter if you're in the hospital setting or if you're in the street.
Then I realized the solution wasn't figuring out how to stay forever. The solution was replacing myself.
When Black women tend to step into rooms, we're not just only looking out for Black women. We are looking out to improve the entire environment, the entire system. And I think when we step in to actually open things up for ourselves, we end up opening new possibilities for the whole systems.
It doesn't help to just continuously fill gaps.
Yeah.
You have to eliminate gaps.
I have the privilege of being president and CEO of a very respected hospital and healthcare system. Whomever is seeing this can see, yes, this is something I can do, and there's somebody that I can look to that's already done it.
Medicine is a calling. I truly believe that. It's like being a priest, a pastor.
I just find it to be the most satisfying career in the world. There's nothing else that I would want to do.
Everyone has a unique first experience with the medical system here. The seed of each person's career is as different as any two stars in the sky. Bright lights that look the same from a distance can have such very different journeys.
It's who I am. I love the ability to make a difference in someone's life, even if it means one person.
We may be the first, but we certainly don't want to be the last. We have to be able to give back as we move forward.
People like me had never met a Black woman who's a doctor, who was a lawyer, who were all of these things that seem to be possibilities for young men. So I think telling that story and also celebrating that it's so different now is one of the reasons I'm so excited about your project.